Thanks. So hi there, I'm Dr. Heather Sandison, and welcome to Brain Health Hacks for Cognitive Function and Mental Health. So in 2017, Linda came into my office with dementia, and she sat down, and by the time I started asking her questions, I could see her brain working, I could see the wheels spinning, but she couldn't remember the question long enough to give me the answer. She also had certainly her relationships were affected, her handwriting was affected. She had quite severe dementia. On a 30-point scale, she had a MoCA of 2. This is the Montreal Cognitive Assessment that we use in my office to assess the severity of dementia, was extreme. She had 1 or 2 word answers like yes and no or up or down, but she wasn't having real conversations. She came in with her husband, who was very dedicated and desperate, to be real. He would do anything to help her. And so he had found out about the Bredesen protocol that I had been recently trained in. And we sat there together and we figured out a plan. He did it to a T with her. And 7 weeks later, she came back and she was noticeably different. She was speaking in full coherent sentences. They were bickering about something that had happened on their way to my office, and her MoCA score, we could measure that it had improved from a 2 up to a 7. Now, I had heard from well-meaning instructors that dementia wasn't something that you could reverse. And when I saw what was possible for Linda, I realized that that wasn't true, and that there was some part of the population, even with severe dementia, where we could reverse it. And so since then, I've essentially dedicated my professional career to figuring out who we can help, when we can help them, how much confidence we have, and what the best things are to do. So that's what I'm here to share with you as professionals, as attorneys. I know that your cognitive function is of the utmost importance. We've all been through COVID, which has increased anxiety and depression for many of us. And those two things are intricately linked. So I'm not able to advance my screen here, I think, because I am not maybe the host. Sorry, guys, you're gonna have to help me out here because I am not able to advance my screen.
Okay, I just made you host.
Thank you. So dementia and depression are intricately interwoven, as is anxiety. And some people refer to these as flip sides of the same coin. We know that people with a history of depression in their 30s, 40s, 50s, then as they age, they are at higher risk for a diagnosis of Alzheimer's. The same thing is true with anxiety. And even anatomically in the hippocampus, the memory center of the brain, there are neurochemicals and even our metabolism there, how efficiently we turn fuel into energy in the hippocampus can affect both mood as well as cognitive function and memory. So when I'm talking, although my clinical view is definitely through the lens of dementia as well as mental health, but primarily these days dementia, while I'm talking about dementia, we mean mental health. Many of the same things that we do, the interventions, particularly at the stage of early cognitive decline or in prevention, are one and the same. The interventions are the same. And so this is exciting to me because what we're doing is we're really taking a whole health view of not just the brain, but the entire body. And our goal is to optimize function. And that's really what I hope that you will take away from this, is that although I study later stages of Alzheimer's, what I'm learning is how exciting it is that we can prevent this and that we can even optimize cognitive function earlier on. So again, I guess you'll just have to advance when I ask you to, if that's possible.
Sorry, Doctor. Oh.
Okay, so this is from the University of Irvine, UC Irvine, and what I want to point out to everyone is that normal aging, we often assume that senior moments are normal and that everyone is going to experience these things and that you don't need to see a doctor, you don't need to tell anyone about this, that these cognitive changes, if you are starting to spend more time looking for your phone, say, oh, I would have remembered that word 10 years ago, but I'm not remembering it as quickly these days. That is actually a sign that, in my opinion, you should go to a trained professional, and they should be able to give you some answers about what you can do. For women, often this may be something that happens with menopause. So as estrogen and progesterone, when there's less of them in our brains, those certainly have an impact, not just on vasomotor symptoms like hot flashes, but also on cognitive function, because the energy we're able to utilize is directly linked to the hormones that are present. Same thing with thyroid function. So this idea that this is normal aging, I would sort of challenge that assumption and really encourage anyone listening here today that if you've noticed, or if a family member has noticed that they're having slight cognitive changes, that then you encourage them to get help and to certainly look into this. Now, there's also a preclinical phase where we can measure in cerebral spinal fluid and on PET scans that there are histological or pathophysiological changes happening in the brain. And this is before anyone notices any cognitive decline. And really, from my perspective, that is the absolute best time to intervene. And that's what we're talking about here today, is prevention. What does happen, and which can be quite scary, and certainly dementia can be debilitating financially, emotionally, and so destructive in so many ways to relationships, this slippery slope starts in mild cognitive impairment, and it seems to snowball. So the decline is faster and faster the more advanced it gets. So that I agree with here in terms of dementia being that red line where it's going down very quickly. So the problem is, in my mind, is that we call it mild cognitive impairment even when we can measure that there is cognitive decline going on. So unfortunately, this pre-symptomatic stage you don't know about unless you're involved in a clinical trial where they're measuring spinal fluid or changes in PET scans, but it's really the best time to treat. And I hope that in the coming years, this will start to shift, and that me having the opportunity to give talks to people like you will help us all change the conversation around what's possible for our brains. Subjective cognitive impairment, this is a little frustrating for many people because they show up to the doctor, they say something's changing, and there's not really much that we can offer. So that's what we're talking about here today. Mild cognitive impairment is really the misnomer. So mild cognitive impairment, this is a pretty late stage in the pathophysiological process. This is almost like telling somebody with stage 3 metastatic cancer that they have mild metastatic cancer, right? And I think this maybe helps to make everyone feel a little bit better in the room when you say it's mild cognitive impairment. However, that individual is already experiencing changes in their activities of daily living. They may have had their driver's license taken away. They might not be managing their own finances. Their independence is starting to decline, although they're not at that final stage of Alzheimer's where they've lost most of their activities of daily living. So I come to this from a complex system science perspective, because the foundations of brain health, it's not about one thing. There's not one thing impacting cognitive function or mood. It's a lot of things coming together. And so what we're talking about here is balance. We don't want too much, too little, in the wrong place or at the wrong time, of lots of different things. And we'll go into these in detail. This kind of gives us a roadmap for the conversation. We'll talk about nutrients, structure and blood flow, toxins, stressors, and then infections, and how we can shift some of these things from a lifestyle perspective so that we can prevent cognitive decline and even reverse early stage cognitive decline. So nutrients are a big part of this, right? If we don't have enough nutrients coming in, we won't have the building blocks that are necessary to have balanced neurotransmitters. We won't have the building blocks that are necessary to heal. So, and also we won't have the energy necessary to, the brain is an energy hog. It uses a ton of energy. So if we don't have enough of that, then we're going to experience cognitive function fatigue, things that prevent us from functioning optimally in the world. So the sugar versus ketones, our brain prefers to run on ketones. And we can see this very rarely will there be both sugar and ketones in the brain, but when ketones are an option, the brain prefers to use them. Now, certainly speak with your doctor. A ketogenic diet is not necessarily the healthiest diet for everyone. However, for most people, if you haven't tried it, I would recommend giving it a shot. The side effects of the ketogenic diet, if your goal is cognitive optimization, the side effects include better mood, weight loss typically, and a lot of things like lower inflammation and pain, a lot of things that most people don't mind. Now, from a sort of ancestral perspective, this makes a lot of sense that our brains and our bodies can use multiple sources of fuel, not just sugar, because it wasn't available to our ancestors 365 days a year. And so ketones are this alternative fuel source that, and you can imagine if, 100,000 years ago, if someone couldn't find sugar for fuel, then you wanted your brain to turn on, and so that you could go find a food source. And so ketones, the metabolism of the fats that are stored in your system, that would be recruited to be used as fuel in the brain. And there was a sharpness and clarity that came with that. And so I would encourage you to give it a try and see if that is helpful for your cognitive function and for mood. When we get away from sugars, we get off the roller coaster of sugar spikes and sugar drops. I'm sure some of you can relate to that hangry feeling, that low blood sugar where you're irritable, maybe distracted. It's very hard to focus, read something complex, be able to produce anything. And this is because you're on that ride of sugar highs and lows. This also, of course, predisposes us to diabetes and heart disease. And Alzheimer's has even been described as type 3 diabetes, when there's this shift in metabolism, this inefficiency when it comes to turning sugar into fuel. Now, minerals, B vitamins, antioxidants, and amino acids, these are the nutrients that we get from our food. Amino acids are the building blocks of our neurotransmitters, things like glutamate, GABA, dopamine, serotonin, things that you've probably heard of. There are many drugs, pharmaceuticals that intervene at these levels. And if we don't have enough of those building blocks, then we won't have that stable mood. So getting plenty of protein is absolutely vital. Amino acids are the building blocks of proteins. So you can find this both in animal sources as well as in plant sources. Minerals, although they are not part of the neurotransmitter itself, they are very important in terms of neurotransmitter balance, because the biochemical cascades require these nutrients, these minerals, in order to balance out the neurotransmitters. Something like glutamate is a very excitatory neurotransmitter. It helps us to focus, to remember, but it can also cause anxiety if we have too much of it. It requires zinc, magnesium, and B6 in order to be very simply turned into GABA. And GABA is that 5 o'clock Friday feeling where nothing is as big of a deal anymore. It's also what hits us when we have a glass of wine. It hits our GABA receptors. If anybody's ever taken something like Ambien or Xanax, that's a GABA receptor agonist. It's that, okay, I can relax now feeling. If we don't have enough zinc, B6, or magnesium, we're not going to make that conversion of glutamate to GABA, and we're going to be stuck in that anxious feeling. And that predisposes us to cognitive decline. So these are just a few of the quick hits around how nutrients are so essential to our cognitive function and to our certainly mental health. Now, nootropics I have listed here, and these are things like ginkgo, some of the herbs that have been really well studied that we know have an effect on cognitive function, either at the synapse, so where those neurons connect, or as help for neurotransmitters. There's lots of different mechanisms, things like, again, like huperzine, ginkgo, coleus, there's lion's mane as a mushroom. There's a lot of them. Curcumin. These are all really important. And then, of course, they're all options that we can use. And then also omega-3 fatty acids. Those fatty acids help to keep inflammation down, which we know is one of the mechanisms that puts us at risk of dementia and cognitive decline, as well as pain. And it can help with skin and mood and lots of other things. So the ketogenic diet, I get lots and lots of questions about this, and please put them in the Q&A. I'd be happy to answer them for you. We can see on the left here, a ketogenic diet is not bacon 3 meals a day, right? A ketogenic diet is very plant-based. We want lots and lots of plants, and we're using animal proteins like eggs, lean meats, lots of fish, salmon is great, and olives, olive oils, lots of good healthy fats, minerals like salt, and then lots of great spices. So a ketogenic diet is not about just having meat all the time and butter, right? It's a mostly plants with some good high quality proteins. Then on the right-hand side, we can see this is very clearly a processed foods diet, right? Like this is a mac salad, rice, katsu chicken plus the side of bread is not the best diet for our brain. Neither is anything that has a lot of high fructose corn syrup, right? In the bottom right, we can see the things that are in packages that are clearly have a lot of processing going on. Our brains don't love this in terms of helping us have the best mood or cognitive function. Now, the questions come up when we start talking about things that are healthy. And I grew up in the 80s and 90s, right, where we had this food pyramid, and the bottom, it said 8 to 10 servings of carbohydrates, of grains. And many of those were processed grains in the form of rice, pastas, breads. Rice isn't as processed, but even rice noodles, things like that that are highly processed. We were told that those were healthy for us. We're also told that fruits are healthy. Now, I would say the processed carbohydrates are not healthy for anyone, especially in excess. Fruits, on the other hand, are part of a healthy diet. Now, the trick here is understanding what the goal is. So a ketogenic diet, which has been shown to be helpful for dementia, for cognitive function, for weight, for mood, that if that is the goal, then it's like a light switch. You're either in ketosis and burning fat for fuel, or you are in glycolysis and burning sugar for fuel. And fruits are going to put you in glycolysis. They are going to provide the sugars that have you burn that for fuel. So it depends on your goal. So if healthy generally is the goal, then absolutely you can eat fruits. But if cognitive function is the goal, then you want to try probably to get into that ketogenic state. Nobody should be in ketosis forever, just like they shouldn't burn sugar all day, every day for their entire lives. No one should be in ketosis all day, every day for the rest of their lives. This is about dynamic ability to respond to environmental pressures, right? So as the concept here is the hormetic effect. So as we increase the stress on the system, what we hope is that the system then has an ability, a better ability, more resilience, better health, a better ability to respond to what's available. And so that's the goal with the ketogenic diet, is that we get this, a little bit of stress on the system, but then we are better able, better resilient, more resilient to respond to things in the environment. So it's not that fruit is unhealthy, it just won't help you achieve ketosis. Another thing we want to talk about is structure. So blood flow and oxygen, right? We know that if we're not getting enough oxygen to our brains, if we're not getting enough blood flow to our brains, this is essentially a stroke. And that is a type of traumatic brain injury, and certainly can lead to cognitive decline. And there's a spectrum here, and that's really what we want to talk about. So getting enough blood flow can have to do with posture, right? So if we're sitting all day, every day, we're not getting great flow to the brain. We have 4 major arteries going to the brain, and 2 of them in the back, the vertebral arteries, they go through very small holes in the bones. And so if our neck is pinched, if we're in the wrong position, if our head is very far forward of our shoulders, it's going to pinch off that flow. And although it may not get no flow to your brain, it certainly won't get optimal flow. And so you won't have optimal cognitive function or mood. Traumatic brain injuries are another piece, and I kind of think of these in 3 categories. If you've had them and they were a long time ago, there are things that you can do. Functional neurologists, usually chiropractors, they have approaches that can be very helpful even decades later. I've seen people turn around from traumatic brain injuries that are very old. And then anyone who has a traumatic brain injury that's relatively new, within the last 18 months, there's a bunch that we can do nutritionally. Traumatic brain injuries are directly associated with dementias, with cognitive impairment, and certainly CTE, as in in the National Football League, they have studied this to some degree, and both mood imbalances as well as dementias are associated with repeated head injuries. So we want to prevent them. So prevention is really the first thing. If you have a hobby, or if a loved one has a hobby where there are repeated head injuries, I encourage you to get a new one. If you have had a recent, or someone you know has had a more recent head injury, I encourage you to reach out to someone who's well-trained to help you to get that to heal as much as possible, because that really sets us up later for issues. The other piece here is sleep apnea. My takeaway message here is treat it. I've had patients, I refer liberally to sleep medicine because I see how much of an impact it has on people's mood, cognitive function, and certainly energy levels during the day. So if anyone has ever suggested that you snore, I don't care if they snore more than you, I would encourage you to go to sleep medicine and get worked up. Now I have people who come back to me and say, oh, well, sleep medicine said I just have mild sleep apnea. And my response is, well, are you okay with mild brain damage every night? I'm not, as your doctor, I am not okay with you having mild brain damage every night. If you have any amount of apnea, even if it's below the threshold, I would recommend doing something to treat it. And there are several options. The one point I want to make here is that sleep apnea doesn't always happen to people who are overweight. Now, it certainly can, that's a risk factor, but thin people can have sleep apnea. And some of the ways to know if you are someone where you might be concerned about this, you might want to ask a specialist or ask your doctor, is if you're noticing daytime fatigue that you don't have a great explanation for, if someone has told you you snore, or if you wake up with a dry mouth and you regularly breathe through your mouth. Optimally, you will be breathing through your nose at night. And if you're not, then you're not getting optimal air exchange in your lungs. And then you're going to reduce the amount of oxygen going to your brain at night. And this over time is a problem, as is sleep deprivation. So we now know that sleep deprivation in your 30s, 40s, and 50s can lead to higher rates of cognitive decline later in life. So options for supporting nose breathing. There's a few, of course. On the right here is a CPAP. And many of my patients complain about it's uncomfortable, maybe it's too drying or it's too humid. What I would say is if you can ask your sleep doctor about the option of an APAP or an alternating pressure, it's been called the Cadillac of CPAPs, that is sometimes much more comfortable. There's also options with a nose pillow and a nasal cannula. There are lots of options. There's been certainly an advance in this field in the last 5 to 10 years. And so there's travel kits. One of the big pieces with a CPAP, if you're using one or an APAP, is to make sure you keep it clean. So get those tubes changed out, use the whatever cleaning kit they send with it, make sure that's clean, because if mold or something else is growing in there, that can affect your cognitive function. So we need to keep that clean. Other options outside of a CPAP, many people are just opposed to them completely. They're also loud, they can disturb your partner. So I get it, not everybody wants to use one, but you have a couple other options. An oral appliance that you can get fit by a dentist can help to keep the airway open, and that's the one in the middle here. An example from the Cleveland Clinic, where you're basically pulling the jaw forward at night so that that airway stays patent or open, and you're getting plenty of oxygen, and then that's getting to your brain. Another really simple, inexpensive thing to try, particularly if hearing this today is making you alarmed about yourself or your partner, someone you love, it's something that you could order today is the Somnifix. This is a mouth tape, which initially can sound a little uncomfortable and a little scary, but most people who I've suggested it to thank me. For $20, you can get a handful of these and try them and just put it over your mouth at night. It'll keep your mouth closed, which essentially makes you get in the position where you can breathe through your nose at night. And again, this is going to be very, very helpful for cognitive function and for preventing cognitive decline, as well as fatigue the next day. And your partner might also thank me because it can help with snoring. So toxicity, this is an area of more controversy. So I'll be straight up about that in terms of its direct effect on dementia. However, I have seen clinically mycotoxins in particular in my office, where it's a very direct link between an exposure to a moldy or water damaged building and someone's brain fog. When they get out of it and when they detoxify these things, it goes down. Now, you guys are the legal experts, and so you'll know that there are lots of interests here between landlords and tenants and all of that stuff that I try to stay way away from. I'll leave that to you all. However, for me and from my perspective, the health of my patients is, of course, utmost priority, and I have seen a clear link. We also have a lot of data from the animal husbandry industry, where a lot of emphasis, money, time, and effort goes into making sure that mammals have lower levels of mycotoxins, because it certainly directly affects their health, their fertility, and their productivity. So mycotoxins are the toxins that are made by mold. So Botox, many of us know about Botox. Botox is a neurotoxin. It is the toxin made by botulinum, a bacteria. Mycotoxins are the group of toxins that are made by mold. There's lots of examples of bacteria, viruses, and molds that make toxins. So it's not the mold itself that is detrimental, it's the toxin that the mold makes that can be very, very neurotoxic for us. Heavy metals as well, very toxic in Hawaii. Of course, the concern is ahi and other fish that can have lots of mercury in them as we go up the food chain. So the shark is the worst in terms of heavy metal contamination, but certainly swordfish, and some of the other pelagic fish that are very popular in Hawaii are very high in mercury. And mercury is, again, directly neurotoxic and is 10 times more neurotoxic than lead even. So we want to make sure that those levels are relatively low, and you can get those tested. There's simple blood tests that your doctor can do, any doctor can do, and then you can see more of a functional doctor that can help you to get more specific heavy metal testing if that is a concern for you. And then chemical toxins, there's a woman, her name is Stephanie Seneff out of MIT, and she's published extensively about the role of glyphosate in particular. This is the active ingredient in Roundup. And so she makes the case that we should be eating organic food, particularly things that are heavily sprayed. They don't tend to be on your ketogenic diet, so you don't have to worry too much. But things like wheat, soy products, and then corn are heavily genetically modified and sprayed. And she shows links in her research between those chemical toxins and neurodegenerative diseases like dementia, Parkinson's, and ALS. So something to be aware of that is out there, although again, somewhat controversial. And alcohol is another one, less controversial, although not as fun to hear, that we know does directly impact cognitive function. I think most of us can remember a night where maybe we overindulged and the next day our brains were not as sharp. So this also has a cumulative effect. And if there's overindulgence in alcohol, and even small amounts of alcohol are not great for us. So what can we do about it? We can avoid the things that we can avoid. We can't avoid everything. Exhaust fumes, everyone's pretty much exposed to these days. We can't avoid it all. However, you can choose to be eating healthier things, avoiding alcohol for the most part, and avoiding really moldy and water damaged buildings, avoiding heavy metals or the fish that are high in heavy metals. These things can reduce your total toxic burden. The way I think of it, it's like our bodies are a vessel, and when we fill all the way up, now it's overflowing into symptoms. Now it's creating inflammation. And so as we reduce some of these things, as we let them out through detoxification, we don't want to let them in, that's the avoidance. And then as we help to get them out through detoxification, all of our cells are going to work better. So some quick and easy ways to do this. One, we're going to use all of the organs of elimination. So how our bodies naturally do that, we just support it. And the skin and lymph is a great one. So this is just sweating, really. This is moving and sweating. Every time we sweat, many of the toxins that are circulating in our system can come out of them. So I recommend to shower right afterwards so that they wash those toxins off of you. You may have smelled toxins coming out of you after maybe a day of indulgence, or sometimes people just notice that, oh, that there's a smell of paint or something after a hard workout. Definitely, this is a way that we can get a lot of toxins out of the system. It's how our body's designed to handle them. The liver is also a place that does a lot of the heavy lifting when it comes to getting rid of toxins, whether we have made them. So every cell eats and poops, and so we have metabolic toxicity that builds up, and the liver is responsible with the bowels for getting rid of that. So things that are liver supportive: artichoke, eating artichoke, dandelion tea, thistle tea. These are all great things that you can do that are very safe, very easy to help support your liver. The kidneys, drinking great water. There's wonderful water available in Hawaii. Tap water even is quite good. And so drinking plenty of it becomes the key. For most people, as long as you don't have a kidney issue, about half of your body weight in ounces is a good amount to shoot for. Certainly discuss this with your doctor. If you have a kidney issue, all of this advice goes out the window. But for those who have functional kidneys, half your body weight in ounces, if you're not hitting that, then I would encourage you to increase the amount of water that you're drinking every day. Every time you pee, we are getting rid of toxins, whether we got them from the outside world or our body made them themselves. Bowel movements, I've had patients tell me, oh, I have normal bowel movements. And when I inquire further, they're having one bowel movement a week. That is not normal. So most of us will feel better if you're having a bowel movement every day. And certainly these metabolic toxins, waste from our food, waste from our cells, waste from the outside, those will pile up. And then the fancy word for it is enterohepatic recirculation. What's in our bowels, our gut is designed to absorb things as well as store things. And so when our liver has done the work, the heavy lifting of getting these toxins out and spits it into the bowel, you need to evacuate your bowels. If you don't, then that enterohepatic recirculation kicks in and you start reabsorbing those toxins. They go back into the bloodstream, back to the liver, and now the liver is taking out the trash from yesterday as well as today. So if you're not having a bowel movement every day, please talk to your doctor. This is a goal. If a patient comes into my office and is not having a bowel movement every day, that is step number one, no matter what their complaint is. If it's headaches, fatigue, cognitive decline, hormonal issues. Hormones are also something the liver needs to detoxify, spit into the bowels, and then you need to get rid of. So really, really paramount that you are having a bowel movement every day. And if it's not formed, again, if you have loose stools, there's lots of different reasons for that. Please see a doctor. That is also not normal. And so we want good, healthy bowel movements daily. That's a reflection of the health everywhere else in the system. And also a cause. The gut is so related to the brain, we know, in many, many ways. But the nutrients, if you're having loose stools, you may not be getting those nutrients we talked about initially. We need to be digesting, absorbing, and assimilating those nutrients. So this is a sign, a very early sign, that there's imbalance in the system if your bowels, if you're not having a regular, well-formed, easy to pass, complete bowel movement every day. The lungs often get ignored here. So breathalyzers are used to figure out if somebody's been drinking and driving, right? Every time we exhale, we get rid of toxins. That's the way we get rid of not just the toxins associated with alcohol, but many, many others, metabolic toxins and otherwise. So taking advantage of that and taking some mindful breaths every day, or even a detox breathwork course, can be a way to help the lungs do the job that they're designed to do, which is to help you get rid of toxins as well as gas exchange. Also helpful for stress reduction, which is where we're headed next. So stress, we know, is directly associated with cognitive decline. And some of us maybe have experienced this firsthand, right? Stage fright is a form of stress and forgetting. This is one of the reasons that some people will say that torture doesn't work, right? Because it's very hard to remember things when you are under high amounts of stress. So what can we do about it? Meditation, exercise, rest. These things are so, so important. Prioritizing sleep. I've already mentioned that we know that sleep deficits in our earlier years, 20s, 30s, 40s, 50s, can predispose us to dementia later in life. We all have had the experience of jet lag or some reason we were sleep deprived, and then it was hard to remember the next day, or it's hard to focus the next day. So that has both immediate effects and cumulative effects. So prioritizing rest, even though society doesn't always let us and our jobs don't always let us, it's still something that I would highly encourage you to schedule to make sure is a priority. Same thing with exercise. So we talked a bit about blood flow and some of the things that could inhibit blood flow, including sleep apnea and traumatic brain injuries. Exercise is the flip side of that. Exercise is what helps us get blood flow to our brain. And also, when we talk about blood flow into the brain, that's just as important as the blood flow out of the brain. We were talking about detox and toxins that can accumulate. So the lymphatic flow and the venous flow out of the brain is very, very important as well. And most of this is happening at night. Most of the detox process in our brains is happening at night. So another reason why that rest is so important. Meditation, the kirtan kriya, the satanama with the hand movements, 12 minutes a day of the Kirtan Kriya meditation has been proven to help dementia patients. So we do that every day at Marama. I own a residential care facility where we have an immersive experience in this lifestyle that is the best hope for dementia patients. And they do the Kirtan Kriya every day for at least 12 minutes. So there's a lot that we can do here to reduce, and not just reduce the stressors, but reduce our relationship to them having harmful effects, right? We want enough stress, and exercise is a great example of that hormetic effect. We want enough pressure on the system that we have resilience, that we increase capacity, but we don't want so much that it is leading to some debilitating process happening. So what we know about stress is that certainly too much of it, PTSD, increases the risk of Alzheimer's dementia by 2 times. The caregivers for somebody with dementia have a 2.5 times the risk of developing Alzheimer's disease. So these are typically it's because caregivers are living a lifestyle where they're under a severe amount of stress because of the need to care for someone with dementia. So if you or someone you know is a caregiver, please encourage them to take care of themselves. We can't serve from an empty vessel, right? So infections are another piece. What we know is certainly we've found out that a handful of infections are directly related to dementia. And particularly for people who have the ApoE4 genetics or genetic predisposition to developing dementia, if they have herpes or P. gingivalis, which can cause gum disease, or Borrelia burgdorferi, which is the Latin name for the bacteria that causes Lyme disease. These things we know directly can create the inflammation that leads to neurofibrillary tangles and tau proteins and beta amyloid plaque formation in the brain. So really for anyone, we want to keep the viral load and this bacterial load down. COVID-19 also in the last year and a half has both direct effects on neurocognitive function as well as indirect by isolation, depression, anxiety, all of the things that we know and we experienced can certainly impact cognitive function and mood, of course. And the virus itself seems to have an impact on brain inflammation and some neurodegenerative processes. P. gingivalis is one that I really want to highlight here because oral health is so important to cognitive health. It's also important to cardiovascular health. So I measure something with my patients called LPPLA2, and this is a factor in the bloodstream that basically tells us there's a lot of inflammation in the endothelium or that inner lining of the blood vessels. And this can certainly have an impact in the heart and in the brain. And so P. gingivalis is something that can directly impact that LPPLA2 level. And if I ever see that elevated in a patient, I'm referring them straight to the dentist. And I would highly encourage you all to be getting flossing every day. If you ever see blood, if you're spitting blood after brushing or flossing your teeth, get into the dentist and get better about brushing and flossing. Get that treated. If someone has told you that there's an abscess or an infection or you have any sort of gum inflammation, get to the dentist right away. Be assertive about getting that treated because this can directly impact your brain and your heart to, significant things as we're aging. So where the research is right now, where I get some of my confidence telling you all of these things, in the past, we've kind of cherry picked. So what is that one thing? How do we get rid of beta amyloid plaques? There have been billions of dollars spent, decades, really countless resources thrown at reducing the amount of beta amyloid plaques. And what we found in terms of cognitive decline is that didn't get us where we wanted to go, which was better cognitive function. And so recently, just in the past year, in 2021, my mentor, Dr. Bredesen, has published 2 trials, and I'm collecting data for a similar trial to the one on the left here, where they saw 84% of participants with mild cognitive impairment. Again, that should be called like stage 3 Alzheimer's, but so measurable cognitive decline. They had an intervention that was individualized and comprehensive, going through all of the things that you and I just discussed. toxins, nutrients, infections, structural issues, stressors. They had health coaches and they were advised with exercise. They were supported with diet. They were supported. So all of these participants went into a trial. There were 25 in their study, this one on the left. And they, what they showed is that 8.5 times out of 10, they were getting improvement in cognitive function, something that many of us have been told is not possible. So this is why I've dedicated my life to speaking to anyone who will listen about this and publishing the trials and creating resources for people to implement this at home so that they don't have to go down that destructive and horrific, torturous path of dementia. On the right, what we can see is another trial that was published just in the last few weeks where Dr. Bredesen's group, they have a recode protocol, which is accessible through an app online, and there's less hand-holding. So there weren't health coaches, there were clinicians who were trained, but a little less hand-holding, and still 51% of participants who went online, read the resources, or probably a caregiver read resources and incorporated this lifestyle of a ketogenic diet, lots of plants, treated sleep apnea, all the things that we've discussed. 51% of them improved. Now, some of them also, you can see on the left, 4% had no change, and on the right, 23% had no change. So that essentially means that there was a stabilization. And for someone who has mild cognitive impairment, or even kind of those more, especially those earlier stages of impairment, if they are not dramatically decreasing, this is a win. This really allows us to maintain a lot of that, that just enjoyment of life, that quality of life. Now, certainly this doesn't work for everyone. So we can see even with a lot of hand-holding, 12% of participants declined, and with a little less hand-holding, 26% of participants did have a decline in their cognitive function. So it doesn't work for everyone. And certainly I am dedicated to figuring out who does it work for, who doesn't it work for, how can we just decide who that is so that when my patient asks me, should I put resources and time and effort into this, I can have more confidence that it will hopefully work for their loved one or for them. And then also, I'm so inspired by Dr. Bredesen. He calls and emails me, he's like, Heather, who's not getting better? We got to figure out why. There's a reason. So we are certainly approaching this as an opportunity. Whenever we see that people are not getting better, we see it as an opportunity to find out what we're missing, how we can improve these protocols, how we can help and support people even more. So thank you so much for your time. I think I've not seen anything in the chat yet. So if there are questions, I'm not sure if they're in the Q&A or chat or if anybody can send them to me, but I'd be more than happy to answer questions. What I have here is the contact information, the websites for two doctors on Oahu who I learned from. Dr. Curtis Takimoto-Gentile was kind enough to have me come shadow 10 or 12 years ago when I was in training, as well as Dr. Lori Steele-Smith. She's in Waikiki and he is over by the university. And then Krishana, his daughter, another Dr. Takimoto-Gentile, is she's a elementary school friend of mine. So just full disclosure, and is also a doctor there working with her dad. So Andrew has a question, are there medications that help with dementia? So there are several medications that are approved for dementia, things like Aricept and Namenda. They don't work particularly well. So what we're really looking for an alternative to that. What we've seen is that the medications really don't help, unfortunately. I wish it were as simple as just swallowing a pill, but really it takes some hard work of changing your diet, exercise. All of the things that we discussed today are really what we have more confidence in. Claire is asking if I follow a vegan diet. So no, I don't follow a vegan diet. I think that plant protein you can get a lot from, and certainly there are environmental reasons to follow a vegan diet. My recommendation for most people is to switch your diet. So again, thinking about what we know from ancestral diets is the consistent thing is that they were inconsistent. So you want variety and you want to mix it up. If you're somebody who's been eating macaroni salad and squid luau for the last 30 years, it's time to switch it up. So always, I would recommend a seasonal diet. That's less of an issue in Hawaii because things grow wild all the time. But it's certainly in the summertime, it's easier to have more maybe of a raw vegan diet. And then as we go into the winter, having more cooked foods, maybe more animal protein makes more sense. But switching it up is important. I will absolutely send you a copy of the PowerPoint slides. In the PowerPoint slides, when you look at them in my notes, you'll see lots of links to the literature and the scientific literature that I'm referencing here. Vitamins and supplements from Mickey. Thanks for the question. So I do recommend vitamins and supplements. And in Dr. Bredesen's book, so I'm going to stop sharing my screen so that you can see these books. So this is Dr. Bredesen's book, The End of Alzheimer's Program, which a lot of mine is, my process is based off of. He lists supplements that you can start with. There are a bunch, and there is one, since you're asking. I don't make any money off of this, but Qualia Mind is a product that I really like that does help. It's a supplement that you can get online. You may want to run it by your doctor. It does have, you should run it by your doctor. It does have some caffeine in it. So if you're sensitive to caffeine or you tend towards anxiety, it might not be the best fit. However, it has a lot of the nootropics and a lot of those nutrients that we were talking about in the beginning that really are the foundation for healthy cognitive function. Hyperbaric oxygen treatments from Simone. My opinion of hyperbaric oxygen treatments, I've seen them be very, very helpful for some patients. They tend to be costly and they take a lot of time. There's also contrast oxygen. If you're not familiar with that, exercising with oxygen and contrast oxygen therapies are other things that you can consider, where I've seen patients get more benefit quicker when they are exercising or moving while they get that oxygen therapy. With hyperbaric oxygen, you are tending to just kind of like lay down and relax. And so your blood isn't circulating as much as if you're working or you're exercising. So it's just something to consider and to put on your radar. livo2.com is a place where you can get some more information about that. And then good supplements for sleep, thanks from Mike, other good supplements. So I would really recommend that anybody who's considering supplements, there's a lot of things that could potentially be good. And then for you as an individual, there's probably an 80-20, well, there for sure is an 80-20 about what's probably, there's a 20% of those, that long list that's really important for you. And what I do with patients is I test. So I look to see what's abnormal in their labs, and then we supplement based on that. So if somebody has low omegas, we're going to add more omegas. If somebody has more of a cardiac risk, then we're going to add more cardiac support. If someone has high toxicity, we're adding more detox support. So when we think about these causes of dementia, or these causes of cognitive decline, they're not mutually exclusive. I have plenty of patients who have all of these things are an issue. And then I have other patients where the only thing that was a problem was they had a head injury. And so what we want to do is not be giving anyone too much, right? You don't want to be taking too many supplements. Supplements should be supplemental. And so we want to choose those things that are right for you, it's not really a one size fits all. So I highly encourage you to reach out to Dr. Steele-Smith or Dr. Takimoto Gentile, and they can help you with this lab testing. They can help you work through this process. Is there a risk of too much exercise or physical dementia and the onset of Alzheimer's or dementia? From Derek, thank you. So great question. And this is at the beginning, I was talking about, the complex system science and balance and making sure it's not too much, too little, in the wrong place or at the wrong time. And exercise is a stressor we can certainly get too much of. So people who are competing in the Ironman over and over again, that probably, there might be a psychiatric thing going on, but also, I'm just kidding, but also it can be depleting, of course, right? So there is such thing as too much exercise, and particularly too much too quickly if you're deconditioned. So again, working with a physical therapist, working with a yoga instructor, somebody who can be there with you to help make sure that you're not going to get injured. Exercise is good for everyone, but we need to do it in the right way for you. As we age, because I work with elderly patients, dementia and fall risk are two of the really big issues that we have to be careful with. and that can be so debilitating and limiting
Is he there?
in terms of their independence. And exercise is something that can help someone maintain independence and significantly reduce fall risk. So, and then of course, bone disease. So highly recommended that there is exercise and that we don't get too caught up in the too much piece, but do it safely. I don't see any other questions unless somebody wants to send some my way. Oh, what is the best way to deal with a dementia patient with violence and anger and hostility? Thank you for that question. You know, we are, I just want to send my love to anyone who is dealing with that with a family member. It is so challenging. And typically the Lewy body process, I don't know if there's a diagnosis there, but the Lewy body process typically shows up. So it's a type of dementia. It's not Alzheimer's, although there's a lot of crossover that you see Lewy bodies show up in patients with dementia, with Alzheimer's, and beta amyloid plaque show up with people with Lewy body. So there's a lot of overlap there. However, the Lewy body dementia tends to have more of the personality changes. Oftentimes there's hallucinations, delirium, and lots of paranoia. And so this can show up as violence and anger and hostility. And I don't take it personally. It's just their brain. And right now, I don't know of alternatives to, you know, sedation and making sure they're in the safest place for both them and their caregivers, their family, and their loved ones. And I wish I had more to offer you, Andrew. Blood tests that I recommend, and what kind of recommendation after TBI. So certainly working with your provider, but things that come to mind. My TBI sort of approach includes the contrast oxygen therapy, sometimes NAD plus IVs, phosphatidylcholine, phosphatidylserine, B12, and then high dose omegas. So that combination, especially if it's within 18 months after a TBI, it's usually pretty helpful. Now, we can't guarantee outcomes or anything, but working with someone like Lori Steele-Smith, she would be able to help guide you through that process, get you the right doses, make sure that that's super safe and really helpful. The blood tests that I recommend are in this book. Again, there's this book. This is the original book, The End of Alzheimer's. I think it's page 263, if I remember correctly. Around there. There is a list of all of the blood tests. So quick things that you can ask your doctor for are methylmalonic acid or a B12 marker, folic acid, B vitamins directly impact cognitive function and energy levels. Vitamin D is an important one, your thyroid panel, and instead of just a TSH and a T3, or excuse me, a TSH and a T4 is very standard to run. If you can ask your doctor, which certainly Dr. Takimoto-Gentile or Dr. Steele-Smith would do, is a full thyroid panel that includes T3, thyroid antibodies, a deeper dive into what might be going on with your thyroid, because that has such a direct impact on energy levels, cognitive function, and mood. And then certainly full cholesterol panels are really helpful. One thing to keep in mind with cholesterol is many people talk about having cholesterol that's too high. Low cholesterol, below a total cholesterol below 140, I start to worry about dementia and certainly fatigue, and then also mood instability, because cholesterol is the backbone of our stress hormones and our sex hormones. And for anybody who's had a period, been through menopause, or lived with somebody who's had a period or been through menopause knows that hormones directly impact mood and cognitive function. So having enough of the backbone, that cholesterol backbone to produce hormones, is essential. Now, the same thing is happening in men, right? If you don't have enough cholesterol, you're not going to have enough testosterone. And if anybody's been through androgen deprivation therapy, that has a big impact on mood and cognitive function as well. So again, there's a list here in this book, The End of Alzheimer's, about what tests you can ask for. And Dr. Steele-Smith and Dr. Takimoto-Gentile would both be able to help with that. Would you start with a change in diet for a dementia patient who seems to be affected by sugar intake as it seems to increase dementia symptoms? So Karen, I'm not sure if if the sugar seems to increase her dementia symptoms or if the avoidance of sugar seems to increase her dementia symptoms. What happens with the ketogenic diet is that sometimes if someone is going through the detox, there's a bit of a hump that you have to get over before you're in ketosis and you're going through sugar withdrawals. So sometimes as we restrict sugar, they can temporarily feel worse, and that's not a reason to stop all the time, although work closely with a doctor there, because I've yet to see it where someone doesn't do well over time. Now, there's lots of people who don't do well for the first 3 or 4 days. It's hard. It's literally a withdrawal from an addiction. So it can be rough, and I'm not sure if that's what's going on or if you're seeing that someone's affected. Sometimes we see that when people get sugar, that can have a very quick impact. I think that's all of our questions. It's such a privilege to be here, and thank you for the great questions and just everyone's kindness and support and organization. Yeah, okay, so here's another one. Would I recommend working with a nutritionist or dietitian? Yeah, I think it depends on how experienced they are, but there are some phenomenal dietitians and nutritionists out there, and maybe having a doctor like Dr. Sealsmith or Dr. Takimoto Gentile, if they can work in conjunction, just making sure everything's safe and everybody's getting all of the nutrients that they need. I have a lot of faith in them, and if you know a dietitian or nutritionist that seems to be getting good results, then certainly that can be supportive. Very supportive. What inspired my research in dementia and Alzheimer's? So Linda, my first patients, watching people, I guess the story starts really growing up in Hawaii, seeing that people who were sick were not showing up at community meetings. When you're sick, you're really consumed by that. And so you're not engaged in your community, and the world needs solutions and people to show up. And so as I traveled and then growing up on the North Shore, seeing this, that was what inspired me to be a doctor. Now, as I've worked with patients and seen what's possible with dementia, the same thing is true there, right? Somebody with dementia is pulled out of society. They become a liability, not an asset the way they should be. And our elders have so much to give us. They're at their height of their wisdom and experience. And if there's a way to bring them back into the fold of society, rather than parking them in wheelchairs in front of TVs and feeding them cake and cookies so that they just get worse, then I'm committed to finding those solutions and making those resources available so that we can all enjoy the benefits of their wisdom. Anything else? Thank you again for the opportunity. All right, signing off. Thanks, you guys.
Thanks, Heather. It was really nice working with you.
You as well.